My practice is primarily based on cataract and IOL surgery, and using optical biometry has been our mainstay for IOL selection and calculation. But our idea in terms of looking at the OPD was, number one, preoperatively to optimize the preoperative IOL selection for a given patient, and also postoperatively to evaluate our postoperative IOL patients. And that's kind of what we looked at for the OPD. It gave us the value of having an excellent corneal topography unit, as well as looking at the entire wavefront of the eye. So that was kind of our main initiative in acquiring the OPD-3. In our clinic now, we have a group of 6 cataract surgeons in our practice, and I can tell you that basically the OPD-3 has now become our standard. Not only do we do typical optical biometry to calculate axial length as well as keratometry, but the OPD-3 has been a real integral component of every preoperative evaluation, and it encompasses many aspects of our evaluation. Certainly, it's very obvious the premium IOL selection is greatly aided by evaluating the corneal topography. So toric IOL selection is a very important aspect of topography. And not only does it help us to rule out other corneal pathologies that may not be amenable to toric IOL selection, but they also help us to verify the magnitude and axis of our IOL master or lens star keratometry with the OPD. So we really combine optical biometry with topography. Furthermore, it also helps us to evaluate the selection for example, multifocal lenses. We know that spherical aberration, other higher order aberration can be concerns in certain IOLs. I think it's very important to preoperatively evaluate that before operating on a patient, number one, just to discuss with the patient potential concerns. And number two, in terms of selecting patients, we might want to avoid multifocal lenses, for example, in patients who have significant horizontal or vertical coma, or patients, for example, who have a significant amount of spherical aberration. So that certainly has been of value. Being able to look at line of sight and look at pupillary centration can also help in terms of determination of angle kappa. IOL centration being, again, something we feel is quite important for aspheric lenses and multifocal lenses, again, being able to evaluate this preoperatively. So really being able to be prepared ahead of time before going to surgery really gives us the most tools to select our patients. We also really like the ability to show patients the value, for example, using simulation of some of the products that we may be using in the eye, to show a patient the difference between aspheric lenses and toric evaluation as well. So, we've really been able to kind of, utilize all the aspects of looking at the cornea being a very critical structure for the entire visual quality aspect of our patients, that we integrate that with our IOL selection to, I think, really customize our approach. And it's about customizing options here, and without having the right data, it's difficult to do that. Where we really have had further interest with the OPD-3 has been also postoperative evaluation. Sometimes we have patients where we're uncertain as far as what maybe the visual complaints are, what the issues are, and being able to get the entire wavefront, looking at the cornea as well as looking at the internal optics is very handy. So for example, we can assess the toric IOL position and toric IOL power in relationship to the corneal power. This is helpful in terms of looking and evaluating any residual cylinder. And so being able to assess, for example, with retroillumination, the toric IOL tool, which is very nice to be able to see and evaluate where the toric IOL is planned and placed, is a great method to evaluate how accurate we are. It also helps us to evaluate the total higher order aberration in the system as well. It may evaluate why a patient may have visual quality issues. So the postoperative evaluation, which is again another aspect of our practice, of course, it can be aided by patients, for example, who may not be completely satisfied, evaluating exactly what the problem is.